Hi, I am Dr. Robbie George. I'm the Chief of Vascular Surgery at the Narayana Health City in Bangalore. And what I wanted to talk to you today about is what's also called a silent killer. So during my days as a trainee vascular surgery resident in England, we would occasionally have patients who are out doing their gardening or shopping and they would suddenly collapse. And the commonest reason people think of for a collapse is having a heart attack or having a stroke. And yes, they are the common reasons. But another lesser known reason is if you have what is called an aortic aneurysm and if it bursts. Now, what is an aortic aneurysm? So the aorta is the largest blood vessel of the body. It's the main highway that carries blood from the heart and carries blood to all parts of the body. And then it gives off branches to various different organs which need blood. And what is an aneurysm? An aneurysm is a weakening or a ballooning of a blood vessel so that the blood vessel walls, which are supposed to be strong like a pipe, get weak in one area and bulge out. And when they bulge out, the risk is that weakened part of the blood vessel may suddenly burst. And why do we call it a silent killer? Because by and large, aneurysms will not normally cause symptoms. And they are typically in this day and age detected when you're doing a scan for abdominal pain, a chest x-ray or whatever reason. You might see something suspicious and you investigate and find that it is an aneurysm. Now, one of the famous people who had an aneurysm and died of it was actually Albert Einstein. So he had an aneurysm which ruptured and he finally died of it. Our first Prime Minister Jawaharlal Nehru also had an aortic aneurysm, and that is what caused his passing away as well. Now, how do you suspect you have an aortic aneurysm? Essentially, if you're getting a scan for something and they pick up an ultrasound on a CT scan, or they pick up that the blood vessel is big and dilated, it is something that needs to be evaluated. Not all aneurysms need surgery to fix it. Some aneurysms require just monitoring to make sure that they are not worsening, while others will require an intervention. Now, if you do have an aneurysm, what do you need to do to fix it? And if it is of a size where you need to do something, it is fixed typically by two methods. One is by a stent grafting procedure where you place a tube on the inside of the blood vessel to seal it off. And the other option is to fix it by an open operation where you replace the diseased part of the blood vessel. Now, which option is suitable for you depends on a number of factors, including how healthy you are, how old you are, or how young you are, which part of the body is involved in the aneurysm, what are the other blood vessels coming from it. So there are multiple factors that are taken into consideration when you decide whether you want to do an open operation or you want to do a stent graft operation. And if you do have someone in the family who has had an aortic aneurysm, and if you are a male, it is especially relevant that you should get a scan done once you are past 45 to ensure you do not have an aneurysm, because it does tend to be common among male family members. What can you do to prevent aneurysms? Whatever you do for a healthy heart, so that is exercising, staying fit, eating a healthy diet, low in salt and low in high fat and high sugar, and keeping your blood pressure under control and completely avoiding smoking are the strongest recommendations we can make to keep your blood vessels also healthy. I hope you find this useful, but I hope you never find an aneurysm either. Thank you.